So drug makers are currently jockeying to be the next innovators, creating effective and potentially affordable weight loss pills for patients who need them. An experimental pill from Eli Lilly appears to have an edge looking forward, even though it's years away from seeing FDA approval. Well, joining us now is Dr. Payal Kohli. And all you have to do is say weight loss drug, and people react in two different ways. I want it, or what's behind this weight loss drug? So what is making this one and this pathway so different?
Well, you know, we've talked about the injections before, and what's really incredible about them is their efficacy. They get off 15% of your body weight. So now imagine if you could put that into a pill. You could improve cost of manufacture and distribution. You could improve access. And if you can do it safely, you've just put it in the hands of millions more obese Americans that could benefit from it.
I feel like when we have these conversations about these weight loss pills, are we talking about people who are trying to shed a few pounds or people who are managing significant obesity, and then how this could change those patients?
That's right. It's the latter right now. So, you know, we initially started studying this drug for diabetes. Then we realized it's melting off the weight because a lot of people have diabetes and are obese. Now we're realizing for people who have clinical obesity, obesity that's a threat to their life, obesity that's causing high blood pressure, sleep apnea, other medical problems, this medication could really be a game changer. Today in 2023, this is not a medication looking for somebody to shed off a few pounds. I think we need a lot more data before we start to think about it for recreational use, as I like to say.
So when you talk about losing 15% of someone's body weight, that sounds a little all-encompassing. That includes like 15% of your brain. Is it fat? Is it water weight? Is it, or is it just 15% of all of you shrinks away?
It's 15% of your overall weight, and what we're seeing is largely a reduction in fat. We're also seeing changes in their hormonal balance, so their insulin sensitivity can change. But to your point, Tom, what you're bringing up is you can lose muscle mass. Rapid weight loss of that nature can result not just in cosmetic changes, but can also cause hair loss and cause other problems, nutritional deficiencies and such with the body. So I almost wonder if we need to sort of even temper the weight loss, because now we're seeing that newer generation drugs are even going far beyond that 15%.
Is there any concern when someone comes off of these medications that they just go right back to the challenges they were already facing? Is that safe?
That is a concern, and so this is why we need to start rethinking how we think about obesity. Obesity is not getting the weight off and then coming off the medication. Obesity is like high blood pressure or diabetes. It is a chronic metabolic problem where your wiring is not correct. And so this medication is not something you use to get the weight off and stop, because if you stop it, 2/3 of people who stop it will gain some or most of that weight back. This is a chronic medication to manage your obesity just like you would your hypertension or your high cholesterol.
But in theory, you probably are changing behaviors as well, not just changing because you're adding a pill.
That's exactly right. In fact, what we're learning is that it's changing the dopamine reward system in our brain potentially. And this is called an off-target effect. The drug wasn't designed for this, but it's making us have less addictive behaviors, including food addiction, which we think may be part of the clinical phenomena of obesity.
Does the drug we're talking about have a name yet?
So the pills, there are 3 different companies making them, and it's actually, people are likening it to the nuclear arms race, because it literally is like a race to the finish.
It's a lot of money.
Now, I want to make sure, though, that we're doing it safely. And there's also a 2nd-generation drug called Mounjaro, which is an injectable, and a 3rd-generation drug that just got released at the meeting this past weekend, it's called a triple G, because it has the GLP, which the original drugs did, the GIP, which Mounjaro has, plus the glucagon target. So it's hitting 3 different hormones, and that's getting up to 30% of your body weight off, average of 24, but up to 30%.
I was hoping AI would have me lose weight, because AI is the thing everyone's talking about now. So between triple G and AI, I think I'm all set.
I think my eyes have gone cross-eyed a little bit here.
Well, I know, like I said, when people love talking about weight loss, but the idea that you talk about the safety that's involved and the amount of studies that involve, people get impatient, but you say there's still a lot more work to be done.
A lot of work to be done. And, you know, there's some side effects which are tolerable: nausea, vomiting, diarrhea, constipation. But people who've had thyroid cancer, for example, are at risk for thyroid cancer, shouldn't be taking these agents. People shouldn't be using this recreationally. And we don't know the long-term effects of being on these medicines that rewire our satiety, rewire our stomach, essentially, what that really translates into, because they've only been around for a few years.
Go slowly. We'll see what happens. We'll see what happens. Thanks as always. Good to see you, Dr. Payal Kohli.